Me to quickly go over the neurologic exam components that could be a portion of your objective structured clinical exam or OSCE for tomorrow. I just want to start by saying that please make sure that you've looked at WebCT to make sure that you understand exactly what time your testing session is. And if there's a problem with it, get it clarified and corrected today by contacting Kristen Copeland in the Dean's office, okay? The second thing is, please make sure that you're not late, because if you are late, they won't let you in. It's just not worth it, so make sure that you leave enough time. There should be no problem with foothill traffic for those who are testing in the evening, but remember though that sometimes between 3:30 and 5:30, traffic can get to be more difficult, and so don't get delayed for traffic. When you come to the OSCE, please make sure that you're wearing your white coats. I understand that for psychiatry in the future you may not do that, but for this OSCE you want to make sure that you do that. You do not necessarily need to bring examination tools. So for example, you might think that you might need a pen light, or you might think that you need a fundoscope, testing for light touch, pinprick, vibration, the tuning fork, deep tendon, reflex hammer, etc. I will have all things in the rooms for you. If you do walk into a room that requests that you test cranial nerves, for example, there will be a fundoscope in the room. But things will not be laid out for you. So there may be a fundoscope on the wall, because it's a regular clinic room. So if you're a person that needs to see it, to remember to do it, remember that the fundoscope's on the wall, and it'll be very easy to look over that, okay? That would also include Jaeger cards or Snellen cards, for visual acuity. So what I was going to do right now is quickly go over the motor, the sensory, and the deep tendon reflex examinations and sensory testing, so that way you guys have a good understanding of what your exam could look like. Starting from the very beginning, let me start with the motor examination, because that's perhaps one of the easiest to do. If you're asked to do a motor examination, you need to remember that there are 3 components to every motor examination. There's muscle strength, tested on a 5-point scale. There's muscle bulk, and then there's muscle tone. And so you will be expected to do all 3 components of a motor examination if you are asked to do that for one of the doors. So usually what I do is the 2 easiest ones to forget first, which is muscle bulk and muscle tone. And then I personally tend to do strength next. So Bryce, I'm going to have you face this way, because I think the side profile is going to be easier for people to see. So if I was going to check muscle bulk on someone, I'm going to walk up to them, I'm going to take my hands and I'm going to feel their muscle bulk. I'm feeling for asymmetry is what I'm doing. Or you could kind of do it like that. And then what you want to do also is you want to check the legs too. You want to make sure that the bulk of the calves and of the gastrocs feels about the same. So that's how to check for muscle bulk. To test for muscle tone, what I'll do is I'll take his hand and I'll ask him to be completely loose and floppy. I'll hold him here at the distal humerus, and I'll hold his fingers here kind of very distally, and I'll wiggle his hand around like this, and I'll always look to make sure that his wrist is pulled all the way down with gravity, and you do it on the right, and then you do it on the left. I could check muscle tone by kind of wiggling the legs like this, or the other way that you guys know how to do it, and if you lay all the way back, and extend your legs all the way, is to grab the distal part of the thigh and lift the leg up with variable speed, always looking to see if the heel stays on the bed, and you do it on the left and on the right, and then you've checked for muscle tone. Now to test for muscle strength, what you want to do is remember that in the upper extremity, you're going to be testing C5, 6, 7, 8, T1, as well as ulnar median and radial distally. In the lower extremities, we're going to have you check L2, 3, 4, 5, S1, but we don't have you check peripheral nerve function in the lower extremity for this examination. So the way I would check his upper extremities is make chicken wings like this and resist me, C5, make Popeye muscles like this, do this. You could do that also, or make beer cans like this and resist me. That's the other way to do C6. C7 is going to be fingers all the way straight. Don't let me bend them. Don't let me bend them. That's going to be C7. C8 is going to be boxer fists, cock them down. Don't let me pull up. That's going to be C8. And then for T1, what you could do is do this for me, and don't let me pull through, and don't let me pull through. So you notice I always do right, left, right, left, right, left. Then you want to do radial, median, and ulnar. So there's a couple different ways that you could do them. Median is easy by having someone grip as hard as they can. Okay, and now ulnar is going to be usually checked by having someone abduct their fingers as hard as they can, and then radial extend your fingers and don't let me push this way, and don't let me push this way. Now you'll notice that when I have you do this for me, push against me, that's triceps activation, and that's radial, and that's also C7. So you could have also chosen to do motor examination of the upper extremities like this. Do this for me, C5. Do this for me, C6. Do this for me, C7. Do this for me, and box your fist down, and resist me, C8. Do this for me, T1. And then I could do ulnar, separate them really hard. Median, squeeze me really hard. And then radial, resist me, and resist me. And that's probably the easiest way to do a root screen of C5, 6, 7, 8, T1, and the 3 upper extremity nerves, okay? In the lower extremities, you're gonna have someone take their hands, brace themselves on the bed. And so you're gonna do L2, 3, 4, 5, and S1. L2 is take your knee, lift it all the way up, and don't let me push it down. Take your knee, lift it up, don't let me push it down. So right and left, that's L2. L3 is adduction, so squeeze your knees against my fists, that's L3. L4, take your knee and extend it, and don't let me bend it. Take your knee and extend it, and don't let me bend it, L4. Cock your feet up at the ankles, don't let me push down, that's L5. Now, step on the gas as hard as you can, and step on the gas as hard as you can, S1. And so it's quite quick and easy to do. You should be able to do all 3 components of the motor examination of the upper and lower extremities usually in about 3 to 4 minutes, I would think. So if you've got a 10-minute time allotment, you're going to be like sitting there twiddling your thumbs, right? Unless we ask you to also grade the motor scale. And so you need to remember that if we ask you to perform muscle strength testing on someone, and then also to grade it, you need to remember that it's on a 5-point scale. And just like Dr. Yone told you guys today, 5 out of 5 strength is for your amount of muscle bulk and your age, you give me the appropriate amount of resistance. A 4/5 means that for your bulk and your age, you have the ability to give me some resistance, but it's not appropriately enough. A 3 out of 5 means you can get through a full range of motion against gravity, but can provide no resistance. The next number down is going to be basically you can provide full range of motion with gravity eliminated. A 1/5 means you can see the muscle contract, but the joint never moves, and a 0 is you can't even see or feel it contract. And so you need to remember the motor scale for the upper and lower extremities. Yes?
Are you going to be, when we grade it, is it going to say C6 dermatome, or do we write that, the C6 dermatome, or do we not find it?
If I would ask you to grade anything, I would have a graph on the piece of paper that you would have to fill out, and it would tell you, it would ask you what number you would rate their strength at, for example. Okay. Does anyone have any questions for the motor exam? Do you want me to quickly do that one more time? You got it all? Okay. So now the second thing I'm going to do is deep tendon reflexes. So it's possible that you could be asked how to do deep tendon reflex testing as well as grading. And so when you check deep tendon reflexes, your patient needs to be sitting on a table with their arms and legs just exactly like this. You position the patient by having them take their hands, and their palms need to be kind of down like that, okay? Not up like that. Okay, so this is the way you perform deep tendon reflexes. Then usually we ask you to test for the biceps brachii, brachioradialis, and triceps. So remember to get the exam points for this test. What you would need to do is right, left, right, left, right, left. And then in the lower extremities, the patella reflex, and then the Achilles, right, left. So biceps brachii. Take your thumb, kind of apply pressure over the biceps brachii tendon and hit the tendon like that, or take your finger on the tendon like that. That's C5, and this is quite normal. So that would be a grade 2 out of 4. So reflexes are on a 4-point scale. For C6, or the brachioradialis, see how his thumb and his first finger here kind of form this natural plateau. So if you just take your hand and run it up someone's forearm about a third of the way down, or a third of the way up. That's where you hit. And it's really easy to get someone's reflex. And so, you know, that's a very easy way always to get proper positioning for reflex. And so it's a very and then that'd be a 2 also. And then C7, or triceps. As I pinch the triceps tendon over here with my middle finger, and I tap it like that. And the same thing over here. And what you want to do is you want to ask yourself, is the right as brisk as the left? For the patellar,